meetings just a little bit. Thank you, Sandra. So the BHAAC business will be in the second half of the meeting. And we have a couple of members of our leadership team that will be joining us shortly to provide a quick update to you all. So with that, I will pass it over to you, Raquel, and then Tasha to take attendance. Is Tasha on here? I do not see them.
I do not see them on here. I'll send a quick message. Make sure everything's okay. Good morning, Council. Good morning, BHA, and good morning, community members. We are going to go ahead and call our meeting to order at 9:02 on January 15th, 2026. Happy New Year. Since Tasha's not here, I don't have access to roll call. Megan, can you do roll call for us today? Do you have access to it, or can you give me access? Since Tasha's...
I can do both, Raquel. I will put, yes, I have the minutes pulled up, so I'll go ahead and do roll call. You all, I am working from my laptop this morning, and so I only have one screen. So please verbally tell me if you're here. I can't see the windows right now. Danielle Angadi. Robert Archuleta.
Here.
Preston Berry. Whitney Butcher.
Present.
Thank you. Raquel Garcia.
Present.
Thank you. Anaya Hall. Carolyn Hall.
Present.
Thank you, Carolyn. Tasha Konkar. Judge Elizabeth Leith.
Present.
Thank you. Lindsay Maish. Maria Martinez.
Here.
Thank you, Maria. Maria Nagel.
Present.
Thank you, Maria. Keith Parker.
Here.
Thank you, Keith. Carrie Perchinsky. Antonio Pito.
I'm here.
Thank you. Michael Rettenberg.
I'm here.
Thank you, Michael. Jennifer Silva.
Present.
Thank you, Jennifer. Catherine Washington.
Present.
Thank you. Okay, attendance is complete and quorum is met at 9:05.
Thank you, Megan. I'll make it really quick because we're a little bit behind schedule. Just an agenda overview. Thanks for that. There is a BHAAC and a packet meeting packet in the chat if you need to review. We will be having an update from BHA leadership. Dr. Russo is here. Welcome, Dr. Russo. We'll be going over the behavioral health safety net system. We'll take a break and we'll come back and do council business after our break. Just to keep up with time, everyone has access to the agenda. I'm going to give the floor, I'm assuming, to Dr. Russo.
Yes, thank you, Raquel.
Is Dr. Russo on? I can't
Yes.
tell.
Yeah,
Yes.
I am. My apologies. I couldn't get off mute. I was
there you
trying
are.
to send
Okay.
a message. It's a lot going on this morning. My apologies.
There you are.
Good morning, everyone. Good to be with all of you. We had a completely different update planned for you all this morning. As many of you all are aware, on the very, very late night of the 13th, which today is Thursday, so Tuesday, we received notification from the federal government that that our discretionary funding from SAMHSA would be terminated. We received official notification of that yesterday morning around 10, but some of our sister agencies had already received official notification the night of the 13th that the funding was terminated effective immediately. So yesterday was a busy day for us. Some of you were on the providers call in the evening when Commissioner spoke with everyone, notified everybody of the updates that were going on, that we had not received prior notification, that providers could not bill anything after 5 p.m. January 13th. And that it was the COACT grant and solely the COACT grant that had been terminated. However, that was $3 million. So quite an impact to providers. And fortunately, there was at that time no identified impact to staff, but we were in the process and have been in the process of assessing and evaluating what that was going to mean across all of our programs and across our staffing. Late last night, we received notification from Gov's office, and then some news articles also started circulating that let me put a pin there. Important to note, this was a question that came up repeatedly yesterday. Was Colorado the only state that was impacted? The answer was no. This was a termination that went across the country. Commissioner had also verified that with some of her colleagues in Republican states to verify that they too had received termination notices, and it was again across the nation. We received notification late last night that the $2 billion decision, and again, that's across the nation, $2 billion, was being rescinded. So we started doing quite a bit of work late last night, early this morning. We have not received official notification from our federal partners at SAMHSA that the decision has been rescinded. However, we've been advised to continue to keep a lookout for today. Until then, what we do have is an official notification that it has been terminated. And until we receive something otherwise, we are still working from the position that it has been terminated until they receive something different, until we receive something different from us. We are hopeful from the communication that we received that we will receive that rescission, but that has not been received as of this time. That's it in a nutshell. Happy to answer any questions that you all might have. We are tentatively slated to have a follow-up conversation with providers this afternoon. If you have not already, those of you that are providers should be receiving notification later today. It's been a bit of a busy morning, so we're just trying to align all of that with holding off until we receive official notification that it actually has been rescinded. Well, first, let me defer to Monique for any additional information, and then we'll open it up if you all have any questions.
Hi, no, I think you captured everything. We're just monitoring very closely this morning and hoping to get that notification, but as Dr. R indicated, we're hopeful, but just watching and monitoring.
Dr. Russo,
Yeah,
sorry, is that meeting with the providers already on the BHA calendar, or is that where folks can expect to find it for later this afternoon?
Good question. I do not know actually how that has been going out, but yesterday we did make sure that it went on BHA's public calendar. So you can expect that if that is held again today, that you will see it Again, on that calendar, it's tentatively slated for 4:30. So if you all want to keep an eye out, you should see that on the BHA public calendar later today.
Thank you.
Mm-hmm.
Thank you, Dr. Russo.
Yeah, absolutely. You're welcome. Any other questions? Fantastic. Then we will graciously bow out. We have quite a bit of reconciling to do over here in the background. And did I see
Yeah, Dr. Rob, did you have a?
Yeah, Dr. Rob, you have a question?
Yeah, you said that the decision would be rescinded. Is that for all the SAMHSA cuts, or is that just specifically for one?
This is only about the COAC grant that we
Okay.
received notification from. That was the only grant from us that was cut. And again, to reiterate what Commissioner said yesterday, this is BHA speaking from BHA perspective.
Yeah.
We understand that there were cuts from, notifications were received from sister agencies. Everybody is receiving different notifications, so you'll need to hear from them what their take on things are. But that from a BHA perspective, that's just the COAC was the only one that was cut on our end.
Okay. Okay. Thank you.
Yes. And Dr. Rob, I've not forgotten about you. I owe you a response. I promise I haven't forgotten.
Okay. No, it's all good. It's all good.
It's been a little wild over here.
Yeah.
Any other questions or concerns? All right, then Monique and I will graciously bow out. Thank you all for all that you do in contributing and making BHA the robust agency that it is. We couldn't do our work without you. We do appreciate you. Take care.
Take care.
Thanks, Raquel. Continue the great work. Appreciate you.
You got it, Dr. Russo. Thank you.
Bye.
All right, we got our update. We are a little bit behind, 3 minutes behind. I think now on the agenda is the update for the behavioral health safety net system.
Yes, so we should have Alyssa Baker and Amy Hickson, just making sure that they got promoted to panelists.
I'm on here, Megan.
Perfect. Thank you, Alyssa.
Yeah, I'm not sure. I can't see Amy yet, but I know that she should be here momentarily.
Okay, I can message her as well if you want to go ahead and get started.
I just want to put a reminder to council too, if you look at your agenda and you want to see what the recommendations were matched with what we review, that is also hyperlinked in your agenda. So it'll show you the recommendations by the BHAAC for the 25-26 annual report.
And I want to put just a quick message out there. Thank you so much to those of you that sent questions. We'd asked for questions ahead of time by the 12th and got some really great questions. So I know our safety net team is prepared to answer those questions. There were quite a few questions that came in super early this morning. I don't know, for just transparency with that last minute request of the questions, I don't know that they'll be able to get to all of those questions as they were prepared to answer the other ones. But we will make sure that there is a full communication loop to get those questions answered as well if it can't happen today.
Great. And I'm just checking with you, Megan. Is Amy on yet? Does anyone see Amy?
I don't see her. Let me check in attendees and see if she just didn't get.
I didn't see her on there. Megan, I was looking for her.
I do not yet see Amy. Let me make sure she didn't chat me. Oh, she sees us. She's on. Amy is here. Sandra, do you see Jamie or Amy, sorry, in attendees?
I do not see Amy.
It's really weird that she says she can see us. It looks like Mel Tyler has her hand up, and I'm wondering if maybe that's Amy. Yeah. Mel, I just gave you permission to talk.
Can you hear me?
Yes.
Oh, this is Amy. Can you see me? Can you hear me? Am I here?
We can see you and hear you, but you are under Mel Tyler, so we'll have to promote you. That's
Weird.
interesting.
Oh,
Not
is it
under your-
because I used her, she shared, maybe somehow that's how I got looped into the meeting. Anyway, I'm here as, I guess, Mel
Sandra,
Tyler.
can you promote Melanie Tyler, please? Also known as Amy Hickson today.
Do I need
I
to join in?
did. It's just taking a minute for Zoom to move people
Okay.
over.
I've been given, it looks like I have a pop-up inviting me to either stay as attendee or join as a panelist.
Join as a panelist.
Okay. Well, it went away. So if it gives me the opportunity to do it, there we go. Join. Is my camera on? I mean, I'm
No.
sorry, guys. I don't know what's going on.
The link that I sent you, Amy, that's in the chat would probably have you register, and then it would have you join as yourself that way.
Let me see. Let me see if it will.
Stand by. We have technical difficulties. It's okay, Lisa. Lots of tech grace. You just have to in world. You have to.
I am not able to register. Wait. I'll have to sign up for Zoom, Megan, apparently, in order to register with the link you gave me.
You shouldn't have to. I think we should go ahead. Is Alyssa able to get us started? And then, Amy, I'm okay with you being off camera just to be mindful of time because I know you only have until 9:45.
Wait. Okay, I did something.
Oh,
Wait.
there you are.
Oh, okay. Oh gosh.
Okay.
So sorry, everyone. I'm not Mel Tyler. I could never fill Mel Tyler's shoes, but for some reason that's what it says. Anyway, but is this should I kind of hop into it, Megan, or
yeah, let's hop into it. Thank you. Thanks for being here, Amy and Alyssa. Really appreciate it.
Yeah, thanks for having us. We're excited to be here. I've worked with a lot of you in other spaces, and I haven't had the chance to be with you in this space. So really appreciate you having us here. Megan, I don't know if you've had an opportunity, but I would just remind the group or let the group know, many of you've heard, our quality and standard director who's been with BHA for many years, Tom Miller. I know many of you know him. He is transitioning to a different role with CDHS, and his last day is tomorrow. His last day with BHA is tomorrow. And so I am going to temporarily at least fill his shoes as interim division director. And I've previously been with BHA for 3 years this month as the director of licensing and designation. So again, thanks for having me. And if I could just introduce Alyssa, unless you already did, Megan. Oops, not to put you on the
Sorry,
spot.
Amy, I was switching between screens as I'm taking minutes for the meeting.
No.
We kind of introduced Alyssa, but I think a formal introduction would be helpful.
Great. Thank you. Alyssa's been with the licensing and designation team for a couple of years as a licensing manager. We recently hired her as, I think it was December, as the associate director of safety net, which is a role that Mel Tyler had for a while. and Mel has moved on to the regulatory director role. But Alyssa is here in the capacity as the leader. She's new, so go easy on her. She's newly the leader of Safety Net, but she's here to help support any technical answers to the questions you all have. So thanks again. And I think we're prepared to kick off with the questions that were sent. And I think we also might be able to get into, our plan is to be able to get into at least some level of answers to the questions that were sent this morning. We have some information for you all. But then I'll turn it over to you, Alyssa, since I think you officially prepared with those two questions.
Sure. Well, hi, I'm Alyssa Baker. I am the Associate Director of Safety Net Licensing. I have actually been coming to these meetings since I started at BHA, so I really appreciate the space. I really appreciate what all of you do, but I'm usually just on the, observing end. We had two questions come in early. One was from Carrie, and I don't actually see her on. The question was around reciprocity for licensure. Her concerns were that there is a pretty significant difference between what some other states require from a clinician versus what state of Colorado requires, and just indicated that there were it was easier for like nurses and doctors to maybe have reciprocity with other states. I do want to throw out that I am happy we do have connections with DORA. This would be a division of regulatory agencies kind of purview, so I don't want to step on their toes, but we would be happy to connect. Obviously, we work very closely with them in the space, and so we'd be happy to connect anyone who is curious about that with someone who can answer those questions a little bit more thoroughly. The other question that we had was from Jennifer Silva. And their concern or their question was, I would like to ask how the current state budget shortfalls will affect safety net providers. Does the state expect to see a decrease in the number of comprehensive and essential providers? And I think we saw this morning that things went very quickly one way and very quickly another way. And so currently, we don't anticipate seeing a significant decrease in safety net providers. We haven't seen a significant decrease, and we don't, BHA doesn't expect that to be something that is on the horizon. If that changes, I'd be happy to come back to this council and be able to have those conversations about what seems to be the premise on why people are leaving safety net. I think one of the things that I've heard from other individuals is really that the conversation with Medicaid and HCPF, and I have reached out to Meg Morrissey to see if she can also maybe tag team with us so we can have a little bit more robust conversation about what that looks like. From those two, any questions that this council has that I can expand on, or if he brings up? Great. Well, I will pass it back to Amy. Looks like we have some questions from Tosh.
Thanks, Alyssa. Yes, we do. Very thoughtful questions, actually. And so for a couple of them, I'm going to give maybe a high-level response and then ask for some time to put together a more thoughtful response, which I either get to you all in writing, if that's preferable, or be prepared to bring back next time. Let's see. First question that we received this morning was, do you track failed access attempts, people seeking services who can't get in? I have a question about that question. Is that pertinent to safety net services, or is that broadly speaking?
Amy, it looks like Tasha is actually not on our call today,
Okay.
or hasn't joined us yet. And so I don't know if anyone else has that similar question and can clarify what Tasha was asking there.
Well, I think it's the out of the gate, I can speak in a safety net space. In the safety net space, we do track and we ask at the provider level to track and report to us at a regular cadence. We call it refusals, and that would be how we've defined that with providers is folks that were not able to care for at their respective agency. For a variety of reasons, often for a treatment capacity, the agency might be at capacity, or the person presents for care that's complex in a way that agency doesn't offer services for. So we have requirements that providers track that information, including where folks go, like because there's also robust care coordination requirements in those circumstances. So not only are they tracking when they don't offer care or they're unable to offer care to someone who presents for care, they are also tracking what happens next for that particular service recipient, or in that case, non-recipient. So we do track that. And we have they are report to us, and then we check on it as well. Questions about that particular, any nuances there? I think maybe
Dr. Rob has one.
Rob. Okay.
Really, I can help control that.
Somewhat Zoom illiterate here. I'm going to work on
okay.
this.
That's my role here. I got you. Go ahead, Dr. Archuleta.
Yeah. So one of the things that, can you hear me?
I can.
One of the things that I think would be helpful is, especially as we move forward with BHAAC creating a workforce development project or just advisory committee, is, are we tracking when there's a workforce shortage and that's why they're unable? Like maybe there's not, because it's capturing the capacity. That's kind of like, you're going to see that, right? We're already sending bed trackers. We're already doing all that. And then when it's a service we don't offer, but is that an option? And if it is, like, can a provider do that without being dinged, to say like, we have a workforce shortage, blah, 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 whatever, so I just guess that would be my question is that ever tracked?
It is tracked. It is.
Okay.
Tracked.
Okay.
Does that answer your question, Dr. Rob?
Yeah. I mean, we do it. We send when but I don't know if we've ever specifically said workforce shortage, or it's just maybe we say don't have the capacity. You know what I mean? So I don't know if that's specifically something that's pointed out or accepted. So that's why I was asking that.
That's good feedback. Alyssa, let's take that down and make sure that we have the ability to track it at that detail.
Yeah, I think about that, especially moving into the new ASAM and the new era of like different requirements. I think that's going to be more common, and it may come across as at capacity or unable to. But what if they're at capacity because we don't have licensed clinicians, or there's not enough, workforce, or whatever it is, right? So thank you.
Raquel, should I keep going?
Yeah, we have some other questions, so I don't know what order. Are you doing a presentation? Or are we going to gather questions and bring them back to you later? Because I have some regarding ASAM requirements for safety net providers. I have a safety net, Hard Beauty, and other organizations that are providing peer services under safety net. Right now, there's some conflicting information between what HCPUF requires and what CSM says versus what BHA says. And there's some conflict when it's requiring when a community member only wants peer services, right? So for example, I respond to a hospital, or my team is responding to a hospital. I don't, and it's a pregnant person who's struggling with a substance use disorder in labor, I cannot get an ASAM. So, like, especially if there's never going to be a clinical intervention. So, right now, the licensing requires that Peer Services have, and it's the BHA rule, that we provide an ASAM level of assessment prior to service. And that seems counterintuitive to access being the primary priority, especially when it comes to peer services. I'm not saying on a clinical SUD that wouldn't be needed. I'm saying for people who only want peer services, it's a barrier. And then I know Michael has a question in the chat about ASAM. Not applying it to a not SUD also creates a barrier. And just curious what the BHA's influence is in that, considering, like I said, there's some conflicting information coming from the agencies.
Thank you for that question, Raquel. I think I think it's technical. So I'd like an opportunity to dig in a little deeper with my team. I will just remind the group and you out of the gate that at any point, and unless there's a requirement that's statutory, if there are requirements in our regulations that an agency or provider feels are barriers to care or an undue hardship, you have the opportunity to submit a waiver for those regulations. And just with what little I'm hearing of the situation you're describing, that does sound like a barrier to care. And I think that's the perfect opportunity and space for a waiver submission. Whereas, and in those circumstances, we can waive rule for up to a year at a time. So that's an invitation to you. And also, I'd like to take an opportunity to dig into with the team regarding the technical aspects of that question, if that works. I actually think you sent that question to Jared McCoy.
I did this morning, so it was like good timing. So yeah, you have that information and I'll just follow up. I appreciate that.
Certainly.
Yeah, and then I think Michael's question is really important too regarding ASAM and non-SUD.
Let me see what I see.
I'm sorry, I can't figure out how to put my hand up.
Oh.
I don't see
Go
any
ahead.
of the little
Go ahead, Judge Lee.
Sorry, but so in follow-up to that though, we've been trying to get a waiver through since last September. I mean, it takes forever, and even getting to the point of getting a waiver, the idea of a waiver accepted, that took a year and a half. So it's just really frustrating. Let's just say that, to try to get anything done. And in the meantime, people are not getting services and they're very ill.
I'm puzzled to hear. I'm definitely puzzled to hear that, and I'd love to hear the details of the specific waiver you're referencing. Is it Judge Leith?
Yeah, sorry.
Yeah, it was a little blurry for me, but I thought that was you. Hi. Are you? And so, two things for that. I'm puzzled and disappointed to hear that. And I'd be curious as to the specifics of the waiver you're referencing that you haven't heard back from since September. We meet weekly about waivers, and we evaluate everyone that comes through. And we don't have a backlog, so that puzzles me that you've had that experience, and I'd love to know more.
It's the one that's being worked on with OCFMH regarding people in detention in Denver County.
Is it the pilot project with Denver Health?
Yeah.
So that particular situation, Judge Leith, I can talk to you more about it offline if you'd like. But that particular situation, we have a statutory barrier, and so again, like I mentioned to the group, we found a statute. Much of the regulations that would allow us to deliver, or that currently prohibit us from delivering services in the detention center, are waivable by BHA. We encountered some patient rights
Right.
statutes that we can't waive. And so we are working on a legislative solution to that. And I've seen the bill draft. So happy to talk more with you about that offline. If it's appropriate for this group, that's fine too. I'm getting my bearings here, but that's what's going on in that circumstance.
Okay. Yeah, I would definitely like to talk to you offline and provide what support I can to that, because it's really necessary, and I'm sure that the language needs to be fairly specific about what that needs to look like.
Okay. Fair. We'd love to get your feedback on it. And I think I'll circle back up with Ryan Templeton and see where that's at and if it's ready to workshop and how he wants to proceed. But I will, at the very least, get in touch with you about next steps.
Thank you so much.
Thanks, Judge Lee. Thanks, Amy. I just want to circle back to Michael's question about ASAM requirements for individuals who do not have a substance use disorder.
Yes, thank you for that question, Michael. My out of the gate response, and thankfully I have a technical assistant in the background. Mariana Sears, I'm sure you all know her. She's at the helm of the regulatory revisions that are working to align our current regulations with ASAM 4th edition. And she has let me know that we are trying to find a point of balance between SUD and mental health regulation. And to reduce that bifurcation wherever we can, we'd like the opportunity to, and she is saying, yeah, we would like an opportunity to look at any proposals or framework about what works and doesn't work about it. But Michael, for a more in-depth answer to the question that you're posing in the chat, again, we'd like to take that back to provide more detailed response, if that's
not a problem. What I'm seeing in the non-safety net world in BHA licensing true outpatient behavioral health services is that there's an application of the SUD rules to that world, which makes an additional layer of regulation, which makes it more difficult to do the work, which makes the patients go, why are you asking me this? This has nothing to do why I'm coming for services when we're talking about traditional outpatient mental health services.
Thanks, Michael. I appreciate it. We'll ask that. You got that, Amy?
I do.
Okay.
Thank you.
You're welcome. Good. This is great dialogue. I'm loving the back and forth, and this is really what we're about. I'm so grateful for all of the comments. Does anyone else have any other questions? And again, right, since it's last, they may have to circle back with us on and then Elisa and Amy, did you guys have anything else you needed to share about updates or anything like that? I know that you're just walking into this space and getting your footing about you. So, we'll also invite you to come back later in the year. But anything else you want us to know?
Couple things. We did have another 5-6 questions from Tosh. Is that how they like Tasha to be referred to?
Mm-hmm.
So I'm not sure we're going to get to all those, but would you guys like us to put together a response and verbal response to those? Happy to do that.
I think, honestly, I kind of prefer written responses. I think the challenge will be is everybody going back to review video. It's easier if it's just written. If you guys want to give it written, and then we can keep that also in our folder. And I can, Megan and I will store it in our work drive folder so we can go back and review. Does that sound like good, counsel? Do you like that answer? Sound good? Catherine, thank you. All right, Lindsay, thank you. Okay, so we're going to get some written answers. I think it's easier to go back and reference too. So how does that sound, Amy?
We can do that.
Okay.
The other thing I would just remind the group, I'm here to plug the rules work, and we're in open feedback for the next 3 months. We have a variety of we have another 35 or more feedback sessions planned between virtual and in person across the state, and I just wanted to make sure that you all are aware of those and invite or just offer to make sure you have that information if you don't, and send it to you, Megan, or the chairs, however you'd like to make sure the group has that. But just want to make sure you guys are aware of those feedback opportunities.
I appreciate that. We will consolidate those, y'all, and then send them out to council, and then you can disperse them to your networks also. Because I always say if you can't be there, have someone in your your organization or in your community sit present also. I see Judge Leith has a question.
Found it. Thank you.
Okay, good.
So when you are formulating the answers to Tasha's question, can you be specific if you are able? And it's all along the lines of what we were just talking about, the statutory problems versus the regulatory issues. Because all of Tasha's questions, well, not all, but most of her questions are centered around detention and the ability to transition from a detention setting into the community or to receive treatment in the detention setting and then to transition out into the community again. I think it would be really, really helpful if when your team is going through these questions to try to identify to the best that you can where these sticking points might be, because what Tosh is asking is all about the consent decree and the wait list for Pueblo and people being backed up and stuck in jail for a really long time because they can't get services, right? Because they're in jail. They committed some crime. But the background of that is typically they're kind of, or they haven't been taking medications, right? And it's just kind of snowballed to a point where picked up and, put in jail due to either a low level charge or maybe it's a felony charge. There's a whole range of stuff that goes on. But I think it would be really, really helpful if you can try to identify what the problems are, because then we as the BHAAC start to help to support with that and bring some different perspective. Also, if legislation needs to happen, we can be behind you with all of that. And it's more of a community effort rather than the BHA is saying this and nobody knows why and, patients' rights and all of that sort of thing. Because at some point, what I'm understanding is that the pendulum has kind of swung too far the other way, and we need to bring it back to a midline, if I can call it that, so that people can get services better, because our system is frozen. And, there's a lot of people trying to go at this from different aspects, but we're not completely unified with that yet. And we need to have a better voice when we're speaking to legislatures or to modify laws, advocacy groups get involved. And then it all kinds of falls apart. So if we can use these questions sort of as a baseline to identify, exactly what's going on the regulatory statutory level, then I think we can better identify how we can help, make the system work better. Does that make sense?
Makes sense to me. Sorry, Raquel. I apologize.
Yeah. For you, she's talking to you, not to me.
I mean, we want to support. Yeah. We want to support the BHA. We really do. But some of the problems we have is the knowledge gap, right? And it's a little siloed at BHA because you've got, I always make lists of all the people who do all the things, and then I nearly forget who you are and what you do, right? So I try to write it all down so I can go back to my notes and remember. But, this is a place I think where we can have community, real life experiences, get to give feedback. But again, if you can help pinpoint for us exactly what you're seeing are some barriers, and then we can bring our real life experiences into those barriers too. I think we can make a better product and have a unified voice.
I love that. No, I agree. So
Thank you. Thank you, Judge Lee.
Yeah, I agree. Thank you so much, Judge Leith, and Tasha, who's not here, for the wonderful questions. But Tasha's watching this later, even though she ain't here today. Every one of you knows she's going to watch this 3 times. So they will not miss it at all. So thank you. Whitney, you laughing, but I'm right. All right. Well, thank you so much. Is there anything last minute before we wrap up with Safety Net? And we can still pose questions if something comes up, because sometimes those things come up later. So please just send them to us and then we'll get them over to the team. Thank you so much, BHA. Congratulations on your new roles. Let us know how we can support you finding your way. Don't be afraid to reach out.
Thanks so much. We appreciate you.
You're welcome. Bye, y'all. All right. And with that, y'all got 5 minutes. 5-minute break. See you back here in 5 minutes. 9:50.
Sandra, you can pause the recording, please.
I just want to say that it was nice to not be presented to. It was nice to just get some answers and have some dialogue with the people that are running the thing. I think that was a very nice change than what we are used to as a BHAC and a nice advancement in progress for us as a council. Bless you, Megan.
Thank you. And thank you, Raquel. We have been providing guidance as folks come and join us. I know we didn't get to everything that was on our agenda with Safety Net and did not get have time to go over the recommendations from the report. And so I'll leave that all up. I'll leave that up to you all if you want to add that to a later meeting.
Later meeting, or we could maybe compare what kind of they talked about compared to what we recommended last year and just ask for an update of those recommendations. So I think we can do that. We can work on that in executive session and pull that together. Any feedback? Anybody? How'd that go for everybody? Nice change of pace. Carolyn, what do you think? You're on mute.
I have a lot of questions going on in my head. I want to research and learn a little bit more because it sounds like they're trying to put everybody in the same box. And I'm worried about us losing our voice, like it's going to be this way or no way, you know? And so I'm concerned about that.
Good. I'm glad. I'm glad you voiced your opinion. Not glad about the issue. I apologize. So thank you, Carolyn, and forming that question. I know that was in the chat. We'll make sure that that gets up in the follow-up. And as you think of follow-up questions, please just send them and we'll consolidate and give them over to the safety net system administrators for some follow-up. I think it'd be nice too. We don't have to wait for presentation for follow-up, right? We can get those in writing and then disperse. Okay. All right, so we had to jump ahead because of timing. So we're gonna go backwards a little bit and do our council business. So has everyone had a chance to review the December 2025 minutes? And if so, I'm curious if there is any discussion about the minutes. Any questions, concerns about the minutes from December of 2025? All right, seeing as there is none, I'm looking for a motion on the floor to approve the minutes, Carolyn? Motion to approve? I read your lips.
Thank you.
Carolyn put a motion on the floor to approve the minutes. Do I have a second?
Second.
Dr. Archuleta, second. The meeting minutes are approved as is and will be documented as such. Just want to review the upcoming agenda items. In February, we will be getting a review of the budget and legislation, or the legislative and budget update next month. A session just went back into session yesterday, so that should be interesting. I hear it's a robust session. In March, we will be given the BHA roadmap presentation. Workforce work group update. I just was talking to Dr. Rob. Dr. Rob is going to be chairing the workforce work group. We are still looking for a co-chair to support him if anyone has found or wants the opportunity. If you have never led anything before and never co-chaired, look, this is a great place to try something new. You'll have a lot of guidance. We'll offer support the best we can, but it is a great place to step up. I had never done a state council in my life till I did this one. And so there's opportunities to learn. Megan is really supportive. You won't be left alone. And Dr. Rob already has ideas. We've got a skeleton idea of what that's going to look like, but Dr. Rob and I will get together to start planning first meeting, and anybody is open to join that workforce group. Dr. Rob, do you have anything you want to talk about specific with the workforce group?
No, just know that it's not just been left on the table. We've been emailing back and forth. Everybody's giving some ideas. Uh, this was just a really crazy month, but for sure we have emails going back and forth, and like I said, ideas and just thoughts about all of it. So it's not just sitting on a table somewhere. We're working.
We are. Thank you. Appreciate it, Dr. Larcheletta, and I'm so grateful that you stepped up to lead. I think you are going to be phenomenal for that space.
Thanks.
You're a good voice for the workforce because you care. Thank you. Just want to remind everyone that we always have an annual report, right? You guys got a copy of that to review for the safety net recommendations. It's a great way to see what we create every year. And we do have to, right? So when we look back at that workforce or at the safety net recommendations, we'll have to talk about for a gap, like were those recommendations honored? Do we have any new recommendations? So we build that report. And we're encouraging folks, if you're interested in that Tasha will be leading that committee. Any questions about annual report, workforce, before I move forward? Okay, Carolyn, I got you down for workforce. I see that in the chat. All right, moving on. We have met as a committee several times, actually, in little pockets where we could in this a little bit of a busy start to the 26th to start creating and have created the 2026 annual calendar. Take a look at that. We are still open to feedback. I can put it in the chat too. Megan, you got it? If you're doing notes, I can pin it really quick. I got it, Megan. Let me do that for you. So this is a draft of what we have so far on what we would like to hear or review. This is what we want to set out on the calendar. And of course, it's subject to change, right? If life changes, we can adjust this. But what I really like about the calendar is the way we've restructured it. If you notice, we know what's coming up. So we know that we're having budget and legislative presentations next month. And after that is the BHA roadmap. This is kind of nice for us. If you don't like this, if you want to see something different, we would love your input. If something shows up for you in the next few months and you want to see it, just talk to us. We have that conversation in the executive meeting, your executive committee meeting, and we're willing to make adjustments. If there's things you want us to be specific within those topics, like HICPUF Medicaid, we know that'll be a robust conversation in May. Again, right? Also, the idea is to get those questions ahead of time because our new structure is we'd like to feed them the information ahead of time so it's more like today. We were all upset, not because workforce didn't wrong. To be honest, doctor, she did the best she could because that's how it's always been done. But to give a different opportunity is to give questions so we can have a robust conversation and dialogue in this space instead of just being presented slides. So that's kind of the idea for you to think ahead and think of those questions ahead, and we'll propose those to the different entities that would be coming. Any questions, any reflections on the 2026 BHAAC calendar? And I just want to say thank you to executive committee, and I want to say thank you to the annual reporting committee. It's the same folks that keep showing up. And everything hasn't been perfect. I'm so grateful. Catherine, Keith, Carolyn, Tasha, now Dr. Rob joining. Just thank you very much for staying committed and seeing the work out behind the scenes. All right. Any discussion on the 2026 calendar? Let us know. And then just a reminder, right? Oh, wait, did someone talk? Did I miss it? Okay. Making sure. It's like Hollywood Squares. So it like bounces around. Last we had was the budget and legislative presentation preparation, just remembering to get your questions ahead of time so that we're prepared for those questions. And we are at the top of the hour. Anything following budget legislative, any open comments from council? Any discussion from council before I open? Megan, we're going to close out meeting early today because we got done with our agenda quite robust in time.
I have a question.
Come on, Keith.
Madam Chair, let me try that title out. I heard a lot of stuff today about SAMHSA and the cuts and all that, which was good reporting, good information. Is there any good news? Did I miss that? Was there anything positive that we have, that we have? Because I didn't hear any.
Yeah,
I must
well,
have missed it.
yeah, well, what we're doing, so with the SAMHSA budget cuts, like they said, they had a bunch of providers, myself, Dr. Archuleta, ours providers also were called into a meeting, and, we were told nothing. Last night, there was news on NPR and a couple other wires that have opened up, that have said that our funding has been restored. So I can tell you the buzz in the country, because I get to watch it at a national level, is like a big exhale, because they are not
Yes.
being threatened. And I think I heard also Dr. Russo say the challenge is that the BHA has not received an official letter that those funds have been rescinded, but it has been spoken that it's coming. That's where we're at. Not official, but
Okay.
it's coming. That the notice is coming. Funding is supposed to be reinstated.
Okay. All right. Yes, that is some good news.
Oh,
Thank
that's
you.
some good news. The last 48 hours, you can ask Dr. Rob. This has been very challenging. But
Yes.
I will tell you, it's advocacy. Do you know that? I mean, people were calling. I mean, I called several times yesterday. I spent a lot of time in writing emails and letters, bombarding our congressman with what to do. So I can tell you, I've
Right.
watched advocacy efforts. It's really grassroots advocacy made a huge difference. And it
Yes,
was a
that's good.
bipartisan decision too. It was great. So
Mm-hmm. Yeah, that's good to hear. All right. Thank you.
you're welcome, Keith. I appreciate it. Anyone else, any other comments from council? I see a question in the chat. Will the responses given to the BHAC in writing be made public from the safety net, Megan?
I don't know that they will be those responses. We don't generally post those responses on like our website or make it public in that way. I'm wondering if maybe we quick recap of those during our next meeting, so that folks can hear the answers to those questions public. I do appreciate that question.
I agree.
And then we can also include them in the minutes at the bottom of the meeting minutes. Maybe we can put down there. And then that way, that agenda for anyone that attends the next meeting has access to review, viewers access to review the meeting minutes and could see the questions there. Okay. And then I don't know if Lindsay already left the meeting, but she's asking if the BHA can address moving our meeting because it conflicts with a behavioral health disorders and criminal justice meeting that she's in. And the cadence of this meeting has been set since July of 2022.
Yes. It would be a challenge to shift all of our calendars to accommodate that time. I know I'm pretty concrete in my hour already this year. I could not move fully a cadence. I know Dr. Rob is probably in the same boat. Yep, I just saw it on your face. Archuleta, I can read your facial expressions. So unfortunately, at this time, I'd have to say no. We could not move this meeting, not for this calendar year, to another date and time. I know it's always a challenge. I have a couple state meetings that are in conflict. I had the same thing with opiate response, and it's just a challenge, and I had to kind of make a choice, which is hard because I want to be in everything, but I can't. All right. We are ahead of schedule. Can I open up a public comment, Megan, early?
Yes, I believe so.
Yeah, right, Dr. Leith. Judge Leith. You got to choose. Yeah, I'm sorry. All right, we will take the next 10 minutes. It is 10:05. We will open up for public comment until 10:15. It's there. If you want to speak and come off camera or off microphone. You just need to raise your hand if you're an attendee or community member, and our tech team and support staff will remove your restrictions and give you an opportunity to share. We have 16 attendees. Any other public comment or any public comment from any of the community members? We're so grateful when you come. More and more, I've been asking community members to come to the meetings to understand, you do influence this space, right? And we want to hear what you have to say. Our role at the BHAAC is to advise based upon community. And so it's really important that you are here. All right, I don't see any raised hands, no additional questions in the chat or in the Q&A space. Megan, there's only the one question and we've answered that. Am I missing? Oh, I see somebody. You do have a raised hand, Lynn Unger, Megan, or Sandra.
Okay, I think Sandra will have to do it for some reason.
Okay.
My access is not working to promote.
Well, you take notes and Sandra can do the tech piece. How about that? We'll combo it.
Sounds good.
Lynn, you've been unmuted. Sorry.
Lynn, go ahead.
Good morning. I noted in your November council minutes that there was interest in collaboration between different state agencies, the BHA, CDHS, and HICPUF around the strategy around competency, that you all were developing and embellishing programs within the state to support people after they've been assessed for competency so they get the services they need. I was just curious to know if there had been any progress or follow-up on that note from those minutes in November.
Lynn, can you remind me, was that during a presentation?
I do not know. I just took it right off the minutes. I'm meeting with HICPUF tomorrow, and I wanted to, and I brought this to their attention that the BHAAC Council was exploring this. And so I was just curious if there had been any additional movement on this interest from this council.
I can tell you we haven't. I know because we had talked about the summit meeting and the collaboration. As of today, no, I will be honest. We haven't done anything personally as a council, but we will. We had to get end of the year done, and then we got our 2026 calendar done. But I'm glad you brought that back to our attention, and we'll make sure that we have a conversation. I actually have been doing the same conversations between BHA, HICPUF, and just working for that. They had the summit. They used to have a summit meeting where they would all get together and talk, and that does not actually occur. There's pocket meetings I've noticed, but not a collaborative effort there. So I'll ask about the competency things. I think that is something important. And if you're in a meeting with them, bring that up, and I will do the same in the meetings I'm in.
Excellent. I appreciate that. Thank you.
You are very welcome. And we appreciate the accountability of community also. We really do. We are a council who is not, doesn't shy away from accountability ourselves. So I appreciate that. I see you nodding your head, Carolyn. We don't mind. There's a lot going on. There is a lot going on. Oh, Heather, thanks for the comment in the chat. If you guys aren't seeing that, there's a comment that just says, just wanted to let you all know you do great work in keeping us informed, and we appreciate it. So I thought that would be good for y'all to hear as council.
Raquel, I just received in my personal chat a comment from someone from our safety net team who said they would be happy to come back next meeting and answer those questions live.
Oh, that's great. Look, see, People like to come to our council meetings.
You all
Accountable,
are an
collaborative.
incredible group. I appreciate all of the time that each of the council members spends making sure that the people of Colorado are getting what they need in the behavioral health space. We can do this work without you. We're the voices of the community, bringing it back into BHA. So I just really appreciate council, and I really appreciate the thoughtful questions that you've given to our leadership team and our division team leaders when they come to council. It really helps them to be prepared to talk about the information and answer the questions you all have.
All right, well, seeing as we have no more, oh, we got 4 minutes.
One more thing, I just want to share a quick reminder that if you do have additional questions for safety net that were not asked today, please send them to me. You can send them to Raquel and Tasha as well, so that we can make sure that the safety net team gets those in advance, so that when they do come, they're prepared and it's more efficient on time to be able to answer those questions live for you. And in advance, I mean like a week in advance. If you can respond to my email with the agenda that comes out, and I'll put a reminder in there. Sometimes, like, we received questions early this morning, and sometimes that's just not quite enough time to prepare.
I have a quick question.
Go ahead, Keith.
If we do, well, it's kind of like two questions. If we do, it's good. I looked at the agenda, and I don't know if we can fit it in there, but do we have somebody here now? That's one question. And if we don't, can we get somebody from outreach to be on the Zoom? Or do we already have somebody here that I guess represents outreach?
I think we'll have to narrow down. I'd have to know more. I'm kind of curious about outreach, where, what, how, why, all of that. I need a little more information so I would say that might be something, Keith, we want to consider to add to like our calendar to have them come versus someone thinking that they would already be here. That's what I'm thinking. I don't know. What are your thoughts?
Right. Yeah, I don't know why I thought that there was somebody here already that's from outreach that sits kind of like automatic, uh, you know, like one of the panelists. That's what I was under the impression that, or either they had somebody that represent outreach that, or we connected with on a regular basis. That's what I'm trying to say.
Keith, are you referring to when we had the community engagement specialists coming to the meetings? Is that what you're talking about when you're saying outreach?
Oh, but yeah. Well,
Okay.
the outreach that we have inside the BHAAC, that scope of work department, whatever.
BHAAC specifically doesn't have outreach. BHA would have outreach, but BHAAC itself as a council does not have outreach. Can you tell me more? Or do you
I thought
Yeah.
maybe
Go ahead, Dr. Archuleta.
I thought maybe because we did have somebody talking about Colorado Lifts and the outreach that the BHA is doing on this meeting. That was a
Yeah.
while back. Is that what you're thinking?
Yeah.
Yeah,
Yeah,
talking about
that's
services in the community, what's available.
right, but yes, definitely around that time that you're thinking, there was the quadrants was talked about, and then there was a person or a department that did outreach, and we had conversations, about if you have something going on in your community you want outreach to know about, bam, there you go. So I'm saying we need that presence. Either we have a conversation with them on a regular, or they come to the committee, come
I
to
think
the
it is. I think it is, Megan. My takeaway is that it is the community engagement specialist that we had that right that we had in the community where we could reach out, but I think those are no longer, correct?
Those are no longer. So we've shifted the way that we're doing community engagement in that way because that was the model that we were following prior to the BOSO launching. And so that was really BHA staff getting out there in the communities, which we are still continuing to do. And subject matter experts throughout BHA across all of our divisions are in community regularly. And so that outreach is happening more based on ensuring that the people that can answer the questions are coming into those spaces. And then also aligning our community engagement around BOSOs. So Keith, you may also be thinking of when we've had Judith Tiaku, who's our BOSO community engagement administrator, having her come. I don't know that we can ask her to come to every meeting, but I think she was just at our December meeting at a recent one, and we can have her come back to provide updates on what that is looking like as well. I think that's what you're asking.
Yes,
thank you for
that's
providing the further clarification on that.
Yeah, that's a good start. So yeah, thank you for that clarification.
Well, and I
Yeah.
think that gives us something to add to our calendar. We still have some things that are kind of open, and so that's the feedback we're looking for, right? That's what we want to hear, is that's what you want to hear
Yeah.
more of and more often. So we can kind of add that to our calendar too, because that might be something we want to hear more than just once a year, Keith. But we could
Yeah.
talk. Yeah, I think it's a good idea.
All
Thank
right.
you. Thank you.
All
Thank
right.
you.
Thank you. Yep.
Absolutely. Absolutely. All right. Seeing as there's no other public comment, any other council comments? All right, well, I'm going to give you guys back some of your day. Thanks for joining us on our January 15th BHAAC council meeting. Happy New Year to all. Have a great day. Meeting adjourned.
Thank you all. Have a great day.